Happy Friday, Baylor College of Medicine and friends of Baylor. Well, my sister's after me because she wants the 5-point plan for living with the virus. I told her Lily's busy, she's got this space flight coming up, and so as soon as that's over, we'll get to it. But I think it's time we start preparing to live with the virus. I think things are getting better, and we're all going to have to become our own individual experts at risk assessment because no one's going to be able to tell you exactly what to do. So I think we're going to all have to learn, and I'm going to give you some resources to do that. And we also need to follow what's going on in the rest of the world because the rest of the world will dictate whether or not new variants show up. And so we're going to all have to become little mini CDCs. But there's assistance. The CDC.gov website, Johns Hopkins website, and New York Times COVID websites all give information on where the virus infections are, what the state of the virus is. So that should all be very helpful to you all as you do individual risk assessment. So what do I mean by that? If you start thinking about the world, that's the world map. The United States is a moderate risk. Remember I talked about last week, anything under 10 cases per 100,000 is low risk, 10 to 50 per 100,000 is moderate, and above that's high risk. Well, if you look at the map, the United Kingdom is high risk, United States is moderate risk, and Italy is low risk. So I had a physician say, I'm feeling very cooped up after a year of dealing with COVID, wanted to get out, didn't know where to go. I said, go to Italy. There are plenty of places that it's really pretty safe to go. But I wouldn't go to the United Kingdom right now. And why? The United Kingdom's a mess. Look at this. It continues to go up. It's because they declared victory against the virus July 19th. It's been a mess ever since. And you go, well, why should we care about policy decisions made in the UK? Well, I'll tell you why. Remember the old days when the Alpha strain was the worst thing in the United Kingdom? It was the most infectious, twice as infectious as the original virus. And then Delta came along, isolated from India, 4 times more infectious. And it became the dominant strain in the United Kingdom. Before about this past month, before early October, 99.8% of the viruses in the United Kingdom were Delta strain. Well, now there's 6% of the viruses in the UK are a new strain, Delta Plus. Delta Plus has 2 new mutations in the spike protein that leads to enhanced fusion of the viral capsule to the cells and is probably more virulent as a result. It's a variant of interest right now. I personally don't think it will outcompete Delta, but again, these kinds of variants are going to emerge in places that are hotspots, like the United Kingdom. And where else is there a hotspot? This is Russia. Russia is a complete mess. They have climbed over 1,000 deaths per day. You gotta love Putin. They're not going to have any lockdowns in Russia. But starting this week, they're going to have a non-working week where everyone's supposed to stay at home. But that's not a lockdown. That's a Russian version of whatever, stay at home. But on the positive side, he did come up with, in his press conference, he said, you're going to either get it or get vaccinated. So he is trying to push vaccination in his country. And he said, why bother getting it? Why wait for an illness? It's going to have very serious consequences. The trouble is that of the 146 million people in Russia, only 45 million have been vaccinated. And you know why? They have low levels of trust in the Sputnik vaccine. You can't make it up. Well, to quote a famous Russian about get it or get vaccinated, look at the United States map. The southeast United States now is actually pretty low we're all moderate risk. We're all sort of in that 10 to 50 per 100,000. And why? Because most people just got the virus. Unfortunately, it was not the best way to go. It stimulated a lot of sickness and a lot of death. But, now that more and more people are getting resistant, there's fewer and fewer cases in the southeast United States. And the U.S. is coming down. That's good. You can see it's coming down. I put the slope of the decline, this decline, compared to the slope of the decline in the third phase. And you can see it's going down a lot slower. And in fact, it's not acting like it's going to go really down very rapidly. And this, again, is why the Institute for Health Metrics and Evaluation in Washington continues to suggest that we're going to be living with this virus for a long time. Hence my sister's request, how do I live with the virus? Well, what about in Texas? We're all kind of moderate risk. Our friends in Dimmitt are 18 per 100,000. Harris County is at 10 per 100,000. Lily's chewing on her bone. Lily, stop making so much noise. Sorry. But the good news is our case number is coming down pretty significantly in the Texas Medical Center, down to about 698 or 700 cases per day. As I said before, to be in that under 10 per 100,000, we need to be less than 200 cases per day. So we got a long way to go. And we're down to 89 admissions per day to the hospital. So that's good. That's all very positive news. As for boosters, that's all what's hot in the news. Here's what's approved by the FDA and the CDC. If you're 65 and older, you're approved after 6 months of your original shot to get a booster. And if you're 18 years and live 18 years or older, living in a long-term care facility, or if you have an underlying medical condition, immune suppression or transplant or something like that, or if you work in a high-risk setting, so like healthcare workers. For the single-dose Johnson & Johnson, anybody who's 18 and over should get vaccinated with the second shot. Mix and match has been approved, so you can, if you had Johnson & Johnson, you can get a Moderna or a Pfizer booster. If you had Pfizer, you can get a Moderna. You can mix and match as you want. And as you heard, the FDA approved the Pfizer vaccine, or gave it an EUA, emergency authorization, for 5 to 11-year-olds, and we'll find out what the CDC recommends, but I'm sure they'll recommend the same. So by next week, we should be able to vaccinate 5 to 11. So all this is very, very good news. The older population remains the risk population. If you're over 65, you know, it accounts for 67% of the hospitalizations and 85% of the deaths. A lot of them are breakthrough cases. It just shows, again, the highest risk are in the elderly. And it's interesting, though, because the flu vaccine, you know, is nowhere near. We're all you know, bad-mouthing the COVID vaccine, developed too fast, and all this other stuff. Well, the flu vaccine only works in about a third of the patients who are 70 and older. The COVID vaccine works really well in people over 70. So I'm pretty excited that this new technology will allow us to advance vaccines on all fronts. So a couple new studies that are important to think about the impact of boosters. First of all, Israel did a study in looking at people over the age of 60, and what they showed was that by giving a booster, you lowered mild infection by 11-fold and severe illness by 20-fold. So really effective example of what the boosters can do, and that was a Pfizer booster in Israel. And then there was a New England Journal paper this week that looked at the effectiveness of the Pfizer vaccine in adolescents 12 to 18, and it showed that it was 93% effective. So all this is very positive data. The boosters are effective for elderly who are at most risk. The vaccines are very effective in adolescents and in 5 to 11-year-olds. So there's a lot to be optimistic. So I'm going to be officially optimistic. I've been watching the news. A lot of people are saying, you know, we don't know, winter's going to be terrible. Well, we're probably going to have a bad flu season. But I'm beginning to think that, you know, we're going to have something less than a pandemic soon. You know, and I think there's reason to be optimistic. You remember we talked about the Delta virus having an R number of about 6 to 7, which means that we have to reach an 85% of the population being completely resistant to get to herd immunity. Once we're at herd immunity, it'll tend to go down by itself. So there are 320 million people, you know, in the United States. If you think about, you know, we want to hit 85 to 90%, that means we have to get to 288 million people who are resistant to the virus. We've already vaccinated 188 million. We know that 45 million people have already been infected. And when we've looked at prevalence studies, we think that underestimates the number by about threefold. So probably 138 million people have already been infected. And if you think about some of those will be overlapping with those who were vaccinated. So if you throw in half of them, that's 69 million. There are 24 million kids aged 5 to 11. If 65% of them get vaccinated, that's another 15 million people. So if you add all those up, we get to 272 million with our target of 288. That's only 16 million people away. And when you think about it, there's still about 23 million people under the age of 5. So once they're eligible, we will get to herd immunity. I am pretty confident. And as we approach it, we'll see improvement. And so I think there's every reason to begin to be optimistic that by the spring of next year, this will be gone at least the pandemic will be still maybe going on, but as an epidemic in the United States, we'll begin to see it go away or at least reduce. So let's talk about some terminology. So, an outbreak is a rise in disease over what normally is expected in a very small location, generally for a short period of time. An example of this is a foodborne disease like salmonella, let's say, or E. coli. And then, epidemics are basically outbreaks that don't have that tight geographical restriction. So Ebola virus, like, for example, that spread to 3 Western African countries in 2014, 15, and 16 wasn't a good example of an epidemic. And a pandemic is an example that spreads across many countries and many continents. And good examples of that are the influenza, H1N1 pandemic, the Spanish flu, HIV/AIDS, SARS, and Zika virus. So endemic is when it becomes just resident in the population, where we see it, over time. So what do you think might happen as we sort of begin to look at the future? Thanks to our, public health measures and vaccination, it could disappear. Spanish flu disappeared, smallpox, polio has been largely eliminated. It could disappear. Or it could be endemic. In other words, it's constantly with us. And that there are 3 things that determine whether or not a virus becomes endemic. It's the host effects, the environment, and viral factors. And so, the host effects are if you have no immunity. We know now that this virus attacks people who have no prior immunity, so the unvaccinated and kids. That's where the real problem has been. Environmental factors, we've learned a lot. Close contacts, indoors, poor ventilation. We know how this virus works, and those are the factors that determine the environmental factors. And then the viral factors are things like strains, the variants of concern, the alpha, the beta, now the delta strain. If the virus mutates, it can always have a huge impact on what's going on in whether or not it becomes endemic or pandemic. Now, if you think about it, viruses are more likely to become endemic if there's a continuous supply of unvaccinated hosts. That would be either breakthrough cases in vaccinated or people with zero immunity. So who is that? That would be kids and unvaccinated. So that's what's going to determine whether or not we become endemic. And one thing we know is that the vaccination map is highly variable. I've shown this before, but we know that because of this, there will be countries where the entering an endemic phase will be different because some countries will be more resistant than other countries. And that's really important because where there's variable vaccination rates, those will be the places where low vaccination rates where we'll continue to have disease. In high vaccination rates and where places where boosters are available, it's likely to become more endemic. And I think that this is really important to realize that if we don't pay attention, a disease that's endemic can quickly jump back up and be a pandemic again if it mutates or we're not paying attention. That's really, really, really important. So when will we know it's an endemic and no longer a pandemic? Well, for one thing, the WHO and the CDC will declare it so. We will declare it, it's now endemic. But the way we'll know is if there's stable levels of viral infection throughout the country at baseline. That's when we'll know it's sort of at the endemic point. And this will, of course, include minor seasonal variations as we see with flu. And the thing is, we also have to understand, are we willing to tolerate a certain amount of death and disease? I mean, each year, about 200,000 people get the flu, and we have somewhere between 20 and 50,000 deaths each year that we just say, oh, it's the flu. Well, if we get down to the point where COVID is several 100,000 infections and 10 to 15,000 cases, or deaths a year, we might just say, well, that's COVID, and that we won't freak out and talk about it very much, but it'll be a disease that we have and live with. So let's just say, let's imagine a few years from now. Let's say 3 years. 3 years from now, child care calls a poor parent, says, your kid's sniffling, he's got a runny nose and a fever, and it's possible that that'll be COVID-19. The virus that killed over 1.5 million people worldwide and close to 700, 800,000 people in the United States, but it might just be the sniffles, and if the virus sticks around, most adults will either have been vaccinated or will have gotten it and have survived it, so they won't get severe symptoms. They'll just get mild infections. They'll get, what sounds like, an upper respiratory infection. And if you think about the past being an indication of the future, we've had 4 coronaviruses that are around. 3 or 4 of them have been around for hundreds of years, and 2 cause roughly about 15 to 20% of all upper respiratory infections. So, you can imagine when I talked about what's endemic, you need a constant source of hosts that can support the virus. And well, that would be young kids. So young kids are born, they don't have natural immunity. So younger kids will start being the source of these upper respiratory infections, and older people who've either had it or been vaccinated against it will have mild symptoms. So that's what COVID-19, I think, will look like 3 to 4 years from now. If it's not eliminated, it'll become one of the many upper respiratory infections that kids get and adults get later, but don't die as often. But it could be like the flu, where it's a significant source of death. So that's my view of the future of what will happen to COVID-19. If that's the transition, we have to figure out what do we do in the meantime. How do we start liberalizing our lifestyle? And so that will be Lily's 5-point plan. But in the meantime, I want to do a couple of shout-outs this week. First of all, a shout-out to Amos, who's an admirer of Lily's. He wrote Lily, and Lily wanted to say hello to Amos. The second is the Astros. I mean, geez, we're good. Shout out to the Astros. We can win. And then, of course, Lily, who's heading off to space. And I promise you, when she gets back, she will be working on her plan for my sister, how to live with SARS-CoV-2. And in the meantime, have a great weekend, and I can't wait to see you next week.
The doors are opening up. This is the first shot of our Inspiration 4 crew members walking out of Hangar X.
This is amazing.
We're right on time.
Ignition. And liftoff. Perfect use. Go Dragons. Go Falcons.
Commander Lily, you doing okay?
Mr. Houston, you are go for staging. Over. Stand by for mode 4 capability.
Well, looks like everything's good. How about a bite to eat? Lily, what do you say?
Inboard engines are.
Why is Commander Lily outside?
She thinks objects are larger in space.
Where did she get that idea?
Lily, objects appear larger in space. Will this bother you?
I gotta tell you, I'm really looking forward to it.
Will someone retrieve Commander Lily? And don't forget her biscuit.
Mr. Houston, you are go for staging. Over. Stand by.